Excellencies, distinguished guests, ladies and gentlemen, Assalamu alaikum and a very good morning. It is with distinct honor and pleasure I, Tasneema Ifat,
And I, Sabir Ahmed, Assistant Secretaries, Ministry of Foreign Affairs.
welcome you to the opening ceremony of the International Conference on Public Health and Diplomacy, organized by the Ministry of Foreign Affairs and the Ministry of Health and Family Welfare of the Government of the People's Republic of Bangladesh in collaboration with the World Health Organization. This conference is being organized to celebrate the 75th anniversary of World Health Organization.
Bangladesh, as the host of this international conference, has a long-standing commitment to advancing public health issues. Under the guidance of Honorable Prime Minister Sheikh Hasina, Bangladesh continues to advocate for a meaningful and equitable global health partnership as a priority for its economic diplomacy.
Excellencies, we are honored to announce that the event is graced by Her Excellency Sheikh Hasina, the Honorable Prime Minister of the Government of the People's Republic of Bangladesh, as the chief guest. We also have among us Dr. A.K. Abdul Momen, MP, the Honorable Foreign Minister, and Mr. Zahid Malik, MP, the Honorable Minister of Health and Family Welfare.
Ladies and gentlemen, now may I request Dr. M.D. Anwar Hussain Hauladar, Secretary, Health Services Division, Ministry of Health and Family Welfare, to deliver his welcome remarks.
Bismillahirrahmanirrahim. Her Excellency Sheikh Hasina, Honorable Prime Minister of Bangladesh and the Chief Guest of the International Conference on Public Health and Diplomacy, Honorable Minister from CRO countries and esteemed delegations, Honorable Foreign Minister, Honorable Health Minister of Bangladesh, Honorable Advisors and Member of Parliaments, Excellencies, High Commissioners and Ambassadors, representatives from WHO, high officials from different ministries and departments, media representatives, ladies and gentlemen, Assalamu alaikum and very good morning to you all. I would like to welcome all of you in Dhaka, Bangladesh. At the outset, I humbly remember with profound respect the greatest Bengali of all times, the father of the nation, Bangabandhu Sheikh Mujibur Rahman, who introduced a people-centric healthcare system for the first time in independent Bangladesh. His proud daughter, our Honorable Prime Minister Sheikh Hasina, has incorporated public health and nutrition as constitutional right to each and every citizen. Bangladesh has already been an example of sustainable health management system that is good health at low cost and achieved national and international appreciation. The United Nations adopted unanimously the resolution on community clinic concept, the Sheikh Hasina initiative, which is a milestone for Bangladesh also. The COVID-19 management was also excellent and awarded mass admiration. Distinguished guests and dignitaries, if we compare the present progress in terms of life expectancy, vaccination rate, maternal and child mortality, and other health indicators, where we find huge success. Despite the pandemic situation and the existing Ukraine war, there remains a very good balance between life and livelihood in Bangladesh, though the economy has shocked severely. This has become possible under the visionary and insightful leadership of our Honorable Prime Minister Sheikh Hasina. Distinguished colleagues, we have addressed the corona pandemic challenges with a whole of globe approach, and the major learning is, if we want to care for our own health, we must care for others too. Because health issues are involved with multiple disciplines, both within and beyond health science, both within and beyond boundaries. Ultimately, health and diplomacy is now receiving larger scale of attention to modern foreign policy, and that we have to collaborate each other to ensure a global or regional alliance. Within the practical context, this conference on public health and diplomacy may be considered as a very pragmatic and effective initiative for mutual health benefits of the WHO, CRO countries and beyond. Respected audience, you all know the health sector of Bangladesh is now getting prepared for some transitional challenges due to LDC graduation in 2026. Access to vaccines and drugs, one of the concept along with health financing would be definitely the focused areas of those challenges. So, our approach to global health is being forward-looking. We, the CRO countries, are moving towards a sustainable health system through sharing our best practices, experiences, and extending cooperation in the region. Respected ladies and gentlemen, we have to embed health aspect in all policies in an evidence-based way, and together we must invest adequately for health financing. This is how we want to see our role in global health. We strongly believe that each country would reach an insightful way forward from this international conference to achieve the universal health coverage and sustainable development goal, so that no one lagging behind in true sense. Bangladesh looks forward to work closely with all the Southeast Asian countries and the initiatives to be undertaken towards greater collective partnerships, solidarity and unity, so to share the burden and responsibilities in our common goals. Before conclude, I would like to appreciate all countries for taking their valuable time here and make the event realistic. Again, I extend thanks and gratitude to our Honorable Prime Minister Sheikh Hasina to grace the occasion as chief guest, as well as the dignitaries from home and abroad. Thank you all. Joy Bangla, Joy Bangabandhu. May Bangladesh live forever.
Thank you, sir.
Excellencies, now I have the honor to invite Ambassador Masood bin Momen, Foreign Secretary, Senior Secretary, to deliver the introductory remarks.
Honorable Prime Minister, Excellencies, the Ministers from home and abroad, distinguished parliamentarians, distinguished guests, Assalamu alaikum and good morning. I would like to start by paying my deepest homage to the father of the nation, Bangabandhu Sheikh Mujibur Rahman, the martyrs of 15th August and also the martyrs of our liberation war. These epic sacrifices have made our nation as we stand today. Distinguished guests, the COVID-19 pandemic brought to the fore the crucial interface between public health and diplomacy. International diplomacy went into an emergency mode with the onset of the pandemic and continues to remain engaged with its aftermath. The pandemic demonstrated that health issues are no more limited to individuals or a state. It has global implications and resultantly has huge space for diplomacy to contribute. As we witness the ebb of the COVID pandemic, it is time we look back and reflect on our experiences so that we can get better prepared for any recurrence of global health issues of similar magnitude in future. This seminar is humble initiative to that end. The 11-member Southeast Asian group is perhaps the most unified and homogeneous regional bloc within WHO. The group maintains a sound practice of rotating memberships within the WHO Executive Board. It also coordinates its position on critical global health issues and speaks in one voice. We therefore considered it befitting to organize this international conference with high-level representation from CRO member states to mark the 75th anniversary of WHO. With the inspiration of our Honorable Prime Minister, Bangladesh has carved a diplomatic niche for itself on global health issues. Our proven achievements with MDG 4 allowed us to be even more ambitious with SDG 3 towards committing to universal health coverage. Bangladesh has worked closely with WHO in addressing the social determinants of health and in implementing the provisions of the international health regulations. We worked on behalf of the LDC Group in securing time-bound patent waivers for pharmaceutical products under the WTO TRIPS agreement. We continue to advocate for ensuring access to vaccines, therapeutics and diagnostics by low and middle income countries, especially in health emergencies. We had actively participated in the WHO negotiations on the influenza preparedness framework and now remain engaged in negotiations on the International Pandemic Treaty. Some high points of Bangladesh's public health and diplomacy includes our stewardship of a resolution at the UN General Assembly on declaring the World Diabetes Day. We tabled the resolution on cholera prevention and control in WHO towards recognizing the efficacy of oral cholera vaccines as pioneered by ICDDRB. In 2012, Bangladesh mooted the UN General Assembly resolution on the socio-economic needs of those affected by autism and other developmental disorders. The resolution recognized the Dhaka Declaration of 25 July 2011 facilitated by Ms. Saima Wazed, a WHO CRO champion on autism. In 2021, Bangladesh joined other friendly countries in sponsoring the first ever UN General Assembly resolution on vision for everyone. The same year, our delegation worked on a UN General Assembly resolution on global drowning prevention, which was replicated this year at the World Health Assembly. In May this year, the UN General Assembly unanimously adopted the resolution on community-based primary health care, where the Sheikh Hasina initiative of community clinics has been recognized as a global best practice. We stand ready to share this model with other CRO member states and beyond as a bedrock for promoting health for all. Bangladesh is working closely with CRO member states on preparations for the UNGA high-level meetings on pandemic preparedness, combating tuberculosis, and universal health coverage in September this year. With our Honorable Prime Minister leading us from the front, Bangladesh looks forward to championing global health issues in its diplomatic outreach. We hope that this international conference will add further impetus to our efforts in that direction as we reaffirm our appreciation for the role played by WHO in global health governance in the last 75 years. I thank you all. Joy Bangla, Joy Bangabandhu, may Bangladesh live forever. Thank you.
Thank you, sir.
Ladies and gentlemen, now let us hear from Dr. Bardhan Jang Rana, World Health Organization representative to Bangladesh, for his remarks.
Honorable Chief Guest, Her Excellency Sheikh Hasina, Honorable Prime Minister, Government of the People's Republic of Bangladesh, Excellencies, and distinguished guests from Southeast Asia member states, ladies and gentlemen, Assalamu alaikum and a very good morning. On 7 April this year, on the World Health Day, the World Health Organization observed its 75th anniversary. In 1948, countries of the world came together and founded WHO to promote health, to keep the world safe, and to serve the vulnerables, so everyone, everywhere, can attain the highest level of health and well-being. Over the past 7.5 decades, there has been extraordinary progress in protecting people from diseases and destructions. However, much work still needs to be done as we continue to face vast inequity in access to health services, major gaps in the world's defense against health emergencies, and threats from health-harming products and climate crisis. The nature of the 21st century health calls for a radical change of mindset and recognition of how we govern health. It reflects the shift of perspective in terms of health as global public health good with inherent principle of accessibility, affordability, and equity. It reflects a shift from economic driven by profit and pollution to economic driven by fairness and well-being. Success is to be measured by well-being of people and healthy environment. It reflects in engaging and empowering individuals, families, communities for increased social participation and enhanced self-care in health. It reflects in strengthening integrated national health system using primary health care approach to deliver essential quality services with financial protection, with equity-oriented, with gender-sensitive and right-based programming, and to enhance non-state actors to participate in government-led planning, progress reviews, and implementation towards UHC. As mentioned by the earlier speakers, COVID-19 pandemic taught us that diseases respects no borders or socio-economic divides and can affect everyone. Hence, health is one of the few areas in which nations must work together to find common solutions to common problems. Considering the common issues of the Southeast Asia member states, the regional director of WHO, CRO, in consultations with member states, identified regional flagship programs synchronizing with the Sustainable Development Goal for Health and Universal Health Coverage Goals. Cooperation through good diplomacy and making timely and right policy decisions are of utmost importance to achieve the goals of these initiatives. As we know, this year's UN General Assembly provides a unique opportunity to leverage political commitments, ensure synergy, and promote a coherent, integrated, and action-oriented global health agenda, as it includes 3 high-level meetings on health, namely pandemic prevention, preparedness and response, universal health coverage, and tuberculosis. This conference today will provide Bangladesh and its regional member states an opportunity to look into issues of common interest through the lens of public health diplomacy and discuss mutual beneficial actions and way forward. This conference will also provide Bangladesh the platform to share its success stories and initiatives they have led on health and well-being, many of which has been already mentioned by the Secretary of Foreign Affairs, and have the opportunity to learn from the participating member states. I take this opportunity to congratulate Her Excellency Sheikh Hasina, the Honorable Prime Minister, for her commendable leadership in health sector, not only at the national level, but at the global level as well, and for receiving as mentioned by both the secretaries, the recognition from the United Nations for the Sheikh Hasina initiative for community-based primary health care, acknowledging the role community clinics play in promoting primary health care, women's empowerment, community engagement, and mobilization towards achieving universal health coverage. Finally, I thank the government of Bangladesh for organizing this conference as part of the celebration of the 75th anniversary of WHO and inviting me and my colleagues from WHO headquarters, region and country to this momentous event. And I reiterate the commitment of WHO for providing best possible technical assistance in health sector to the member states. Thank you all and for being WHO.
Thank you, sir.
Excellencies, now I humbly invite you to watch an audio-visual presentation that will be shown on the screen.
From a war-torn country to a development role model, Bangladesh has undergone a massive transformation. Our father of the nation, Bangabandhu Sheikh Mujibur Rahman, recognized public health and nutrition as one of the state's primary duties in Bangladesh Constitution. He initiated a program to set up 10-bed health facilities to take healthcare to people's doorsteps.
In the field of health, even a minimum measures of medical relief is denied to over 90% of our population. Immediate measures should be undertaken to establish a rural medical center and every union and a hospital at every Thana headquarters.
Bangabandhu Sheikh Mujib's able daughter, Prime Minister Sheikh Hasina, is carrying forward his vision with her own signature initiatives. The United Nations General Assembly has just recognized the Sheikh Hasina initiative on community clinics. In Bangladesh, 14,500 community clinics are now offering services for 6,000 people each. Bangladesh has emerged as a role model of good health at low cost. Prime Minister Sheikh Hasina received UN MDG Award 2010 for achievements in reducing under 5 child mortality rate. Maternal mortality rate has reduced to 161 in 2023 from 370 in 2006 per 100,000 births. Infant mortality rate has reduced to 21 in 2023 from 84 in 2006 per 1,000 births. Life expectancy has increased from 59 in 2006 to 73 in 2023. In 2014, Bangladesh was declared polio-free, with the last person detected with the virus back in 2006. Bangladesh has achieved 94.6% target by 2022 as per National Immunization Strategy. Around 600,000 children have been given vitamin A capsules in June 2023. Around 26 million school children have been brought under deworming campaign. Prime Minister Sheikh Hasina received Vaccine Hero Award by Gavi, the Global Vaccine Alliance, in 2019. Bangladesh is now heading towards achieving SDG 3 with the highest level political commitment to attain universal health coverage. In public sector, 90% of health services are rendered free of cost. The community clinics offer free essential medicines along with insulin. Bangladesh is among the first few countries in the region to place mental health as part of primary health care. High-quality telemedicine services have been introduced for an efficient referral system. Specialized hospitals and institutions are being set up in Dhaka and other divisional headquarters. The Prime Minister herself is advocating for research and innovation in health sector.
বর্তমান যুগে গবেষণা কিন্তু একান্তভাবে অপরিহার্য। আর গবেষণার জন্য তো আমরা বিশেষ অনুদানও দিই। এমনকি আমরা আমাদের বিভিন্ন স্বাস্থ্য মন্ত্রণালয়ে তো আছি, বা আমি প্রধানমন্ত্রীর যে একটা শিক্ষা সহায়তা ট্রাস্ট ফান্ড আমরা করেছি এবং প্রধানমন্ত্রীর একটা ফেলোশিপের ব্যবস্থা আমরা করেছি। সেখানে কিন্তু কেউ এই গবেষণার জন্য আর্থিক সহায়তা পেতে পারে।
Under Prime Minister Sheikh Hasina's hands-on leadership, Bangladesh has been recognized as one of the world's best success stories in COVID-19 management. Bangladesh has been credited as an example for mobilizing and administering COVID vaccines under COVAX facility. Currently, over 82% of citizens are fully protected with COVID-19 vaccine. Bangladesh's health diplomacy now aims at ensuring equity and fairness in the proposed international pandemic treaty. In addition, Bangladesh calls for maximizing the TRIPS agreement waivers for developing countries. The country now meets 98% of its local pharmaceutical needs through domestic production. With Saima Wazid leading the efforts, Bangladesh has become a voice for those affected by autism and other neurological disorders. Bangladesh is also advancing work on migrants' health, occupational health and safety, as well as climate impact on health. Bangladesh looks forward to emerging as a regional hub for specialized medical treatment, medical research, and health education. As envisioned by Prime Minister Sheikh Hasina, Bangladesh has much to offer in the area of public health and diplomacy. The country stands ready to work together with regional and international partners to save lives and promote health for all.
Ladies and gentlemen, we are delighted to have amongst us the honorable health ministers from a number of countries in the WHO Southeast Asia region.
Excellencies, now I invite on stage His Excellency Mr. Vijayavad Isara Bhakti, Vice Minister for Foreign Affairs of Thailand, to deliver his kind remarks.
Your Excellency Sheikh Hasina, Honorable Prime Minister of Bangladesh, Honorable Ministers, Excellencies, distinguished participants, ladies and gentlemen. It is a great privilege and pleasure for me to join all the Honorable Ministers and representatives from the WHO CRO region at this very special event to celebrate the 75th anniversary of WHO, as well as to commemorate our long-standing collaboration and partnership, which have been so beneficial to our peoples. This forum is an excellent opportunity for us to exchange views and best practices on how best to address the daunting public health challenges in our region through public health diplomacy and international technical cooperation. Over the past 75 years, the world has significantly evolved in all aspects. We have witnessed inspiring success stories of humanity through eradication of smallpox, achievement of more effective disease prevention through extensive immunization and health promotion, and better access to quality and affordable health care through universal health coverage, especially for the vulnerable. But we clearly need to do more, especially to invest in both physical and mental health. We need to learn from our own setbacks to perform better and respond more effectively in the future. Excellencies, health is a fundamental human right that needs to be promoted and protected through unwavering commitments. Recently, the international community has shown signs of such commitment through our relentless fight against COVID-19 and other emerging health threats. Together, we managed to emerge from the pandemic and learn to engage with one another with greater solidarity. And during this post-pandemic period, it is now time to rebuild stronger and fairer health systems with UHC at their core. I would therefore like to commend the Bangladeshi government under the leadership of Her Excellency Prime Minister Sheikh Hasina for today's initiative. It is a testimony to Bangladesh's true political leadership and commitment to ensure that health for all becomes a reality. This can be materialized in the near future if all partners work together like today, in particular to respond to the pressing needs of our peoples, to ensure equitable access to medical countermeasures, and to support the development and provision of global public goods for health, both in normal times and in times of emergencies. I also believe that our collaboration through health diplomacy can help to drive positive changes and advance our fundamental values, namely equity, human rights, and health security. In September this year, as mentioned by various speakers, the world's leaders will gather in New York at 3 high-level meetings on health, namely UHC, tuberculosis, and pandemic prevention, preparedness, and response, to renew their commitments to health. This is another possible avenue to continue our good work and strengthen our partnership, especially to accelerate the implementation of UHC by 2030 and to put the Sustainable Development Goals back on track. Excellencies, distinguished participants, moving forward health through diplomacy is conducive and essential to strengthening international development cooperation. I believe that today's event will serve as a valuable stepping stone towards building a shared and multifaceted vision of the regional and global health architecture after the pandemic for better preparedness and response in the future. I wish you all a very successful and productive event, and I thank you very much for your attention.
Thank you, Your Excellency.
Distinguished guests, may I now invite on stage Her Excellency Safia Mohammed Said, Deputy Minister of Health, Republic of Maldives, to kindly deliver her kind remarks.
Thank you. Honorable Prime Minister of the People's Republic of Bangladesh, Her Excellency Sheikh Hasina, fellow ministers and vice ministers, distinguished excellencies, ladies and gentlemen, Assalamu alaikum and a very good morning to you all. Firstly, I would like to express my sincere gratitude to the government of Bangladesh for organizing this conference on public health and diplomacy. It is an honor and a great privilege to be here to represent Maldives and be given the opportunity to contribute to this very important discussion. Today, I stand before you to emphasize the critical relationship between public health and diplomacy and the profound impact it has on our lives and the world we live in. The role of diplomacy in health is not only vital, but also deeply rooted in international agreements and declarations. In the preamble of the World Health Organization Constitution, it is stated that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without discrimination of race, religion, political belief, economic or social condition. This recognition of the right to health was further strengthened by the Universal Declaration of Human Rights in 1948 and the International Covenant on Economic, Social and Cultural Rights in 1966. These international agreements emphasize the importance of health as a human right and highlight the responsibility of nations to ensure the well-being of their populations. The strategic relevance of health, Your Excellencies, has evolved over time, becoming an integral part of economic development, peace, security, poverty reduction, and social justice agendas. International forums strongly advocate to sectors beyond health, such as trade, economy, and finance, to consider environment and health when developing their national policies. The links between health and security are also gaining prominence, as health challenges can no longer be resolved solely through technical solutions, but require political negotiations and the involvement of various actors. All countries, regardless of their income or level of development, face systematic risks that can significantly impact health, tourism, trade, and international relations. It is in these areas that health diplomacy plays a crucial role. Broader engagement and sharing of best practices between countries strengthen our ability to develop common positions. It enhances our responses to health and related issues. Health diplomacy fosters relationship building, overcoming obstacles, and coordinating responses to improve access to resources, engagement, and harmony while respecting regional cultures. Your Excellencies, the COVID-19 pandemic further highlighted the importance of health diplomacy. WHO's aim in declaring a public health emergency of international concern was to promote international cooperation amongst member states to combat the virus. However, my country first approach by some high-income nations hindered this global cooperation, leading to devastating consequences for low-income countries in their fight against COVID-19. Access to essential medical products, including vaccines, became a global challenge due to vaccine nationalism, border closures, and trade embargoes. Additionally, low-income countries were unable to negotiate with pharmaceutical companies due to their economic status. Amidst these challenges, let us not forget that it is health diplomacy that unites us. It can overcome geopolitical tensions and bring nations together to combat common threats. The Maldives, for instance, faced multiple waves of COVID-19 and experienced economic and logistical challenges. However, through collaboration with member states and cross-regional cooperation, we successfully inoculated all our frontline workers across sectors and achieved over 90% of vaccinations throughout our population. As a result, President Ibrahim Mohamed Solih was able to reopen our borders to tourism, leading us on our path to economic recovery. The Maldives has also demonstrated the power of health diplomacy through the elimination of various diseases and various other public health successes that reduced maternal to child mortalities and increased life expectancies of the population as a whole. Furthermore, Your Excellencies, our current pilot program for primary healthcare, the Fafatol demonstration site, developed in collaboration with international partners like the WHO, is the result of conferences much like this one and lessons learned from other countries, like the Sheikh Hasina initiative. It structures a universal health framework on the current national disease burden, which leans towards non-communicable diseases and mental health. It also thrives on community empowerment, digitalization, telemedicine, multi-sectoral policies, and community-led interventions. Your Excellencies, as we move forward, let us recognize that our collective health depends on collaboration and solidarity. By synergizing our resources and efforts, we can overcome vulnerabilities and work with the rest of the world to address global health challenges. I would like to conclude by quoting Dr. Tedros when he said, "When we work in solidarity in a multilateral approach, we can achieve miracles." Let us utilize diplomacy and work as a collective to create a future where every individual can lead a socially and economically productive life. The world cannot be healthy until all of us are healthy. Thank you.
Thank you, Your Excellency.
Excellencies, now, may I welcome on stage Her Excellency Ms. Leonpo Dasho Dechen Wangmo, Honorable Health Minister of Bhutan, to kindly deliver her remarks.
Assalamu alaikum. Your Excellency, Honorable Prime Minister Sheikh Hasina, Government of Bangladesh, Minister colleagues, distinguished guests, ladies and gentlemen, a very good morning. It is an immense pleasure for me to be part of this discussion, a very important discussion as we recover from the pandemic. I would like to take this moment to share a few thoughts as I was in the forefront of leading the intervention in the country. Bhutan, as you know, is a small country wedged between the two giants. We have India in the north and China in the south, with a population of 700,000. At the end of the COVID pandemic, we had 21 mortalities. 20 of the 21 mortality that we experienced, 20 were terminal patients with incurable diseases. 62 infections and no mortality among our health worker. The result that we achieved, the outcome from the pandemic, is highly contributed to the leadership of His Majesty the King, the benevolent leadership of our King, who was in the forefront leading this intervention. For a small nation to avert a major public health crisis is no miracle. I think it was the shared solidarity of our people. We were applauded for our vaccination efforts. In the beginning of the pandemic, we managed to vaccinate 90% of our eligible population in 4 days. And that received a lot of global recognition. But today, when we look back on the factors that contributed to that success, 3 things that comes to our mind. One is the sense of solidarity. Every Bhutanese in Bhutan recognized the need to get inoculated because they realized that the small country we call home was under danger. So people came together for that reason. Second, the benevolent leadership of His Majesty the King, the compassionate leadership of His Majesty the King, who ensured and made sure that every Bhutanese citizen is taken care through economic incentives, economic programs, social programs, and being in the forefront of this response. Bhutan also had the privilege of being the president of the WHO during this most difficult period. So when I hosted the WHO in the empty WHO office in Geneva, I'd listen to all my health minister colleagues standing up and basically echoing one consistent theme: inequity in access to vaccine nationalism. There were countries struggling to get access to vaccine, but there were also countries destroying vaccines. Our health workers globally were sent out to fight this pandemic without proper PPEs. So during the tenure Bhutan chaired as the health president of the WHO, we advocated for a humanitarian corridor. So like the corridor that you have, a humanitarian corridor, that will ensure that our health workers are protected. So they will be sent to fight disease with adequate protective gears. Every country in the world would get access to essential drugs and vaccines. We are a small country. We are highly dependent on the rest of the world. We produce nothing. Everything that we used in safeguarding the health and well-being of our people are imported. So when we have trade embargoes, when we have restrictions, we are paralyzed. With the mandate to protect the lives, but with no means to do so, it's the most devastating feeling that you won't get. So I hope that this important forum that is being organized by the government of Bangladesh, where we have a gathering of experts, policymakers, political movers and the shakers, diplomats, will also deliberate on few key lessons that we have learned as a global citizen. One is the shared solidarity that we are all in it together, that disease knows no boundaries and we must work together. That's the only way out to actually save humanity in face of crisis. I think we have just gotten over the COVID-19, but I'm also fairly confident that COVID-20 is right around the corner. So if we do not talk and have conversation around shared solidarity, I think we will not be able to fight the next pandemic. Second one, of course, is a robust surveillance system that we must have that encourages transparent data sharing, transparent sharing of information. And I know that I have the privilege and the honor of sharing a platform with Her Excellency Sheikh Hasina as the global leader for AMR. And we know that AMR is a big issue globally and regionally as well. But the only way out is, again, building a robust surveillance system across the region so that we are able to exchange knowledge, exchange data, so that we can design effective interventions to save lives. If not, I think even within the AMR, I think the region is dealing with TB, for example, which is one of the flagship program under Dr. Poonam Khatrapal Singh, the regional director for WHO. But yet again, we are all behind. We look at MDR TB, the incidence of MDR TB, XDR TB, all of these are on rise as we speak. I think there is an urgent need to build surveillance system for antimicrobial resistance, but also for antimicrobial use as well, so that we are sharing our information for the collective good of humanity. Second one, the third one, of course, is to take this platform beyond this conference and create a platform where experts can have conversation, where experts can share ideas, and where experts can discuss ideas so that whatever we design, that is based on science. We cannot afford to politicize diseases. We cannot afford to politicize pandemic, because at the end of the day, we are playing with lives of our people, the people that we serve. So it is so important to have such forums. So I really appreciate and admire the effort of Bangladesh government for bringing us all together to discuss these ideas, how to strengthen collaboration and coordination in our region. Last but not the least is the upcoming United Nations General Assembly. I think there are three most important agendas that are being tabled. I, as a public health professional, I was super excited, I must say, to know that for the first time, United Nations is tabling the agenda on universal health coverage. Because when we talk about universal health coverage, we have often spoken about universal health coverage. We have often had many slogans on leaving no one behind, but yet we have left many behind. In our part of the world, a significant millions of people are pushed to poverty because of catastrophic expenditure on health. There are many people that do not have access to basic health services in our part of the world. So there is a lot that we can do. And the second one on the agenda at the United Nations is TB. And as I rightly mentioned earlier, the TB is a huge concern for the region as well. Every year, even for Bhutan, we are seeing high rise in MDR cases, and that's true in many countries in our part of the world. We have XDR TBs, but yet again, we don't have any information on data sharing on infectious disease. We have a growing concern on antimicrobial resistance, but yet again, there are no systems in place to exchange knowledge and exchange data. And the third one, of course, is the pandemic preparedness. So I'm so happy to see the foreign ministers and the deputy foreign ministers here, because that will be on your table to agree on. And the pandemic treaty, I think we must get it endorsed. I think we cannot wait for the next pandemic, because pandemic treaty will ensure that vulnerable countries are supported. Pandemic treaty will ensure that we have a humanitarian corridor to safeguard the lives and well-being of our people. And pandemic treaty will ensure that there is an equitable distribution of diagnostics and treatment available to our people. So I think for us, we are extremely, extremely happy that the pandemic treaty will be one of the high-level side event at the United Nations General Assembly. Bhutan, of course, with the support from the health ministers of the region, have been very fortunate to take forward yet another important global agenda, which is mental health. Mental health, although the WHO defines mental health and physical health as one entity, but mental health services are almost forgotten in our part of the world. If you look at the report, for severe mental health treatment, there is a treatment gap of 96% in our part of the world, in Southeast Asia region. For many countries, mental health services are non-existent. So that is something that, with the support from the minister colleague during the 75th Regional Committee meeting, we unanimously adopted the Paro Declaration. And Paro Declaration is for providing mental health services using the primary healthcare system so that we deliver mental health where it's needed. We are also hoping that to have a side event high-level meeting at the United Nations in New York in September to highlight the importance of mental health, for importance of providing mental health services in the region. And I hope that we will have all of your support to take the mental health agenda forward as well. So with that, I would like to end by saying that only together we can fight diseases. Only together we can avert public health crisis, and it's only together that we can achieve health for all. So with that, my best wishes, and thank you again for having us be part of this discussion. Tashtele.
Thank you, Your Excellency.
Ladies and gentlemen, may I now invite His Excellency Dr. Thet Khaing Nguyen, Union Minister, Ministry of Health of Myanmar, to kindly deliver his remarks.
Honorable Prime Minister, Her Excellency Sheikh Hasina, the Prime Minister of Republic of Bangladesh, His Excellency Dr. A.K. Abdul Momen, Foreign Minister, His Excellency Mr. Zahid Malik, Minister of Health and Family Welfare, Honorable Health Ministers, Deputy Ministers, Vice Ministers, Secretaries from the Member States of the South Sierra regions, Honorable Diplomats and WHO officials, distinguished guests, ladies and gentlemen, very good morning. It is an honor to be here at the International Seminar on Public Health and Diplomacy. I would like to thank Government of People's Republic of Bangladesh for inviting me to speak on this very auspicious symposium. Public health diplomacy is a chosen method for interaction between stakeholders engaged in public health and politics for the purpose of representation, cooperation, solving disputes, improving health systems, and securing the region right to health for vulnerable populations. In a world that is becoming increasingly interconnected, it is imperative that we recognize the significance of collaborations and cooperation in responding to global health challenges and the unique circumstances faced in the regions. Bangladesh is situated on the west of Myanmar, and we share not only the geographical border but also a common responsibility to ensure the well-being of our people. Both nations have faced the unique set of public health challenges, and it is in time that diplomacy plays a pivotal role in fostering understanding, empathy, and mutual support. We value the harmonious relationships with neighboring countries for attaining sustainable development and health improvement by maintaining close ties and bilateral relations
based on peaceful coexistence, mutual respect, and close collaboration on health service provision. Committed to building a better, healthier future of the people in the Southeast Asia region, Myanmar is working collaboratively with the member states of WHO CRO to address persisting and emerging epidemiological and demographic challenges. Ladies and gentlemen, since the pre-COVID era, Myanmar has been working progressively on the establishment of digital reporting platform. We, Ministry of Health, have demonstrated our leadership with the deployment of the District Health Information Software, DHIS2, not only for data capturing, but also for effective data utilization, supporting the disease surveillance, program assessment, and timely decision-making, evidence-based planning, tailoring to the local situations. We have made out great efforts to tackle the COVID-19 pandemic with the best use of our available resources. We have achieved more than 91% of vaccine coverage for 18 years and above populations. The COVID-19 pandemic has highlighted the importance of global health diplomacy. The pandemic has shown that public health is not just a domestic issue, but also an international one. It has demonstrated that countries must work together to address global health challenges. Distinguished guests, ladies and gentlemen, diplomacy provides a framework for effective communication, negotiation, and cooperation, ensuring that public health remains a priority on the international agenda. We do believe that diplomatic efforts are crucial in fostering international cooperation, negotiation agreements, and mobilizing resources to tackle these challenges effectively. As a health minister, I am committed to working with other countries to address global health challenges. Health as a bridge of peace, health as a humanitarian assistance, health as a common platform, health as a human right or right to healthcare that can create greater awareness and promote peace through diplomacy, fostering trust, facilitating health cooperations, and enhancing social cohesion to harmonize and sustaining peace in fragile affected and conflict affected and violence affected settings. We must work together to ensure that everyone has access to quality healthcare. We must also work together to address emerging health threats such as pandemic and antimicrobial resistance. Taking this opportunity, I would like to thank Bangladesh government and Prime Minister Her Excellency Sheikh Hasina for humanitarian assistance of relief materials including dry food, tents, various types of medicines, and water purification tablets to the people of Rakhine State of Myanmar, which is affected by Cyclone Mocha in middle of May this year. I hope this international seminar will promote the bilateral economic landscape in public health by further enhancing the inherent synergies between the countries and solving the challenges that we are facing. In conclusion, I would like to emphasize the collaboration between countries in public health and diplomacy represents an opportunity for progress and prosperity. It is an opportunity to foster peace, stability, and sustainable development in our region. Let us seize this moment, harness our collective strength, and pave the way for a healthier and brighter future for all. Thank you very much.
Thank you, Your Excellency.
Distinguished guests, now I have the distinct honor to invite Mr. Zahid Malik, MP, Honorable Minister, Ministry of Health and Family Welfare, to deliver his kind remarks.
Bismillahirrahmanirrahim. Honorable Chief Guest,
the mother of humanity, vaccine hero, Her Excellency Sheikh Hasina, Honorable Prime Minister of Bangladesh, Honorable Ministers from member countries, Honorable Ministers, MPs, Excellency, ladies and gentlemen, Assalamu alaikum and a very good morning. First, I pay my tribute to the father of the nation, Bangabandhu Sheikh Mujibur Rahman, and to his family members and the martyrs who laid down their lives for the independence of this beloved country, Bangladesh. Indeed, it is an honor for us to join this international conference on public health diplomacy to mark the 75th anniversary of WHO. If we have learned anything this past year, it is that none of us can go it alone. We have to go together. We can only thrive when we work together across institutions and across borders. That is why it is truly a pleasure to join you in this international conference on public health diplomacy. Preparing for the future means learning from the past. I must thank our Honorable Prime Minister as to join as the chief guest, which means a lot for us and for this event. The COVID-19 pandemic has demonstrated the vital importance of global solidarity to confront shared public health threats. It also shows why we need strengthened multilateralism and top quality diplomacy. Conversely, the pandemic has also shown that when suspicion and recriminations replace solidarity and diplomacy, the virus can gain a foothold and people suffer, country suffers. Perhaps the most outstanding example of health diplomacy was when the world was facing corona pandemic. Vaccine collection was a litmus test for Bangladesh global health diplomacy, an example of solidarity and friendship. We made skillful negotiation with WHO, COVAX facilities, other organizations and countries to secure COVID vaccines under the direction and guidance from our Honorable Prime Minister Sheikh Hasina. We could deliver vaccine to our people covering about 90% of the country, and together all together, considering first dose, second dose and the booster dose, all together is around 360 million doses that we could provide to our people, and that too free of cost. No charges has been taken from anyone in Bangladesh. Even to the foreigners, the vaccines have been given free of cost at the instruction of our Prime Minister Sheikh Hasina. And we are able to manage not only vaccine but also necessary logistics from different organizations, donors and friendly countries. This was possible to our excellent relationship, diplomacy and external leadership of our Honorable Prime Minister Sheikh Hasina. We also saw that not too many countries could arrange vaccine at the right time. So there was a need for vaccine equity, which should be maintained in days to come in the future, because we may be having pandemic or epidemic anytime in future. We like to highlight some of the achievements and facilities which Bangladesh health sector developed for the people of this country, which can be offered for the health services of our regional friendly countries. Under the direction of our Prime Minister Sheikh Hasina, we have established 5 medical universities which are working and some are under construction, where there will be world-class treatment and also educational facilities. In Bangladesh, we have got both in private and government sector together about 110 medical colleges which are providing excellent treatment services and also educational services, and many foreign students from the regional countries from around Bangladesh, in the CRO countries especially, they are studying in Bangladesh and having their also post-graduation in our universities. We have got around 20 institutions. We are proud to have that all the institutions have been conceived and also implemented by the instruction of our Prime Minister Sheikh Hasina. I will name some of the few institutions which are working in Bangladesh and which can be also availed by our neighboring countries for treatment and for education. Burn and Plastic Institution, that is under the name as Sheikh Hasina Burn and Plastic Institute, one of the most modern institution in this region and probably the largest in this region. And some of us say that it is the largest in the world, having about 1,000 beds in that one institution. We have got ENT services, ENT Institute, Ophthalmology Institute for the Eye Institute, Cancer Institute, Cardiac Institute, Neurological Treatment Institute, Mental Health Institutes. Also, we are having one of our best primary healthcare services in the region, and that too has been possible by the Honorable Prime Minister initiative by setting up 14,000 community clinics all around the country. And through those clinics, the services have been taken to the doorsteps of the people, and they are having 32 medicines provided to them free of cost. And recently, at the instruction of our Prime Minister, we have also included insulin and also removed antibiotics from there that will be available through prescriptions only. We have also, at the instruction of Prime Minister, within the last few years we have employed about 18,000 new doctors and around over 20,000 nurses in the health services. We have extensively used telemedicines during Corona for the Corona patients, and still we are doing it, and we have a plan to digitalize the entire health system of Bangladesh. We are also moving towards setting up the universal health coverage at the instruction of our Prime Minister. Already our government is providing free of cost health services to the people of Bangladesh, all the government hospitals, starting from the primary level up to the tertiary level. Only the private sector that needs to be addressed, how we can reimburse their cost. Then I think we will be able to fulfill the universal health coverage requirement. We have also undertaken all these steps to be prepared for any future pandemics that may come anytime. Bangladesh produces world-class medicines which at the moment meeting the entire requirement of the country, and also sending those to 150 countries and exporting those, and all are world-class medicines. In present-day modern world, where communication is so easy and fast that it has turned the world into a global village, advantage are myriad, as we know. Now, as we are sharing our knowledge, experience, business, and health, leading to tremendous development of countries, but there are also challenges as the increase of epidemics and pandemics which takes place within weeks and months, like COVID-19, with devastating consequences to the entire world. Non-communicable disease in Bangladesh are also increasing, as well as in the entire world. For that, the Prime Minister has instructed to set up hospitals and preventive measures to control NCDs, which are causing about 67% of the death in Bangladesh. However, this threat has unified the entire world, countries and regions to tackle and face situation. Rich and poor countries work together to eradicate the pandemic that we faced. This was possible through the prudent action of world leaders, UNO, WHO, non-state actors like Gavi. Leadership matters, as we find in our regional countries and Sheikh Hasina in Bangladesh. She, maintaining excellent relationship with neighbors, led Bangladesh to a safe platform by her untiring efforts and guidance. This has been gloriously reflected in handling COVID-19 vaccination, food production, and economy successfully. No one went hungry or deprived of health care in Bangladesh during COVID. Honorable Prime Minister Sheikh Hasina, experience and devotion we also find in her daughter Saima Wajed, who, being the advisor to DG WHO and also chairperson of Autism Council in Bangladesh, has contributed largely to the health services of Bangladesh. Her devotion and knowledge will enable her to provide leadership in higher and important position in the region. I take this opportunity to recollect the mutual support to the regional countries in time of the need, which are glaring example of public health diplomacy. At the instruction of our Prime Minister Sheikh Hasina, we have sent medicines to Bhutan when there was a request from the friendly country. We have facilitated receiving of students from there for education in our medical colleges and universities. We also, at the instruction of our Prime Minister, also came forward to Nepal by sending medicines, food and medical teams when it was struck by a devastating earthquake. Our Honorable Prime Minister also sent medicines to Sri Lanka when there was a crisis of medicine in their hospitals. This is an evidence of bilateral and multilateral friendship and cooperation between the regional countries, which our Prime Minister advocates very seriously. We also cooperate with Thailand in training of our doctors and nurses and getting a lot of new ideas, systems in areas where we are in need of support, and they have the capacity and will to support us. Ministry of Health and Family Welfare closely works with Ministry of Foreign Affairs to uphold our interest in global health arena. Going forward, we have to put in place a strengthened multilateral system to be better prepared for the future, and so we have to put utmost priority to develop more skillful global health diplomats. We extend our heartfelt gratitude to all the honorable ministers who have come to Bangladesh, taking long journeys and also sparing time for their valuable comments in Bangladesh. We expect to work with all your countries to the best of our possibility. We know that with unity, we can face any challenge in any sort, natural calamity or any pandemic we can face together. Finally, I will request our regional friends that we need to reimagine leadership built on mutual trust and mutual accountability to end the fundamental inequalities. Solidarity and equity will keep us all safer. Before I conclude, I will reiterate that our collective efforts through better health diplomacy that can ensure better health and well-being for all. Lastly, I'm delighted to have our Prime Minister to this conference. Her presence has inspired us all who are here, and I will also expect that our guests and all the experts will have good deliberations on the health issues that we are working together. Thank you all. Assalamu alaikum. Joy Bangla. Joy Bangabandhu.
Thank you, Your Excellency.
Distinguished guests, may I now welcome Dr. A.K. Abdul Momen MP, Honorable Foreign Minister, Ministry of Foreign Affairs, to kindly share his thoughts with us on the conference theme.
Bismillah ar-Rahman ar-Rahim. Honorable Prime Minister Sheikh Hasina, Excellencies, distinguished colleagues and friends. Assalamu alaikum, peace be upon you all. Bangladesh is hosting this international conference at the request of the WHO Director General to observe the 75th anniversary of WHO. We are indeed grateful to our Honorable Prime Minister Sheikh Hasina for giving her kind consent to organize and inaugurate this conference, and also for contributing a video message for the World Health Assembly held in Geneva in May this year. Since returning to Bangladesh from her exile in 1981, Prime Minister Sheikh Hasina had traversed the length and breadth of this country and witnessed herself the plights of our people in the absence of adequate food, safe housing, access to education, and more importantly, affordable health care. On assuming office first in 1996, she made it a priority to find solution to these challenges one by one. It was during this time that she launched the idea of community clinics, with each one having a catchment of 6,000 people. In 2023, the UN membership has given recognition to the Sheikh Hasina initiative as a replicable model for primary healthcare services across nations. The Committee of Nations wishes to hear from her about the ways Bangladesh has overcome and continues to tackle many such development challenges. Sheikh Hasina's community health complex is a public-private initiative. Local leadership provide land and government set up the community clinic. And each community clinic provides primary health care. And in recent days, government, it supplies 30 different types of medicine free of cost. Due to these community clinics, the infant death rate, the maternal death rate, the birth rate, etc., dramatically reduce, and life expectancy of people sharply increased to around 73 years. Prime Minister Sheikh Hasina is expected to attend the UN Food System Stock-Taking Summit later this month to share Bangladesh experience with food security and nutrition. In September last year, she led the Bangladesh delegation to the UN Transforming Education Summit with a commitment to overhaul our education system on the model of blended education. In the same month, UN Habitat applauded her flagship Ashrayan project to provide cost-free housing for the homeless and the landless. In March this year, she called for ensuring the least developed countries' dues under international commitments at the UN LDC 5 conference. In June this year, she attended the ILO World of Work Summit to highlight Bangladesh's achievements in labor sector reform. The international community is certainly taking note of many ways Sheikh Hasina is redeeming the dream of our father nation Bangabandhu Sheikh Mujibur Rahman to put a smile on the face of distressed and deprived people and to achieve his dream of Sonar Bangla and a smart Bangladesh by 2041. During COVID-19, Prime Minister Sheikh Hasina led the nation from the front and made sure that there were minimum fatalities with the country's economy running and recovering fast. The Commonwealth Secretary General recognized her as one of the 3 female leaders who excelled in overall COVID management. Under her leadership, our government remained active on the international front, carrying her message to look beyond the profit motives and consider pandemic vaccines as global public goods. Sheikh Hasina's commitment to build a digital Bangladesh stood the test of time by allowing all spheres of our government and real economy to function without major interruptions. The use of digital services in health and education sectors provided lifeline to many by preventing losses, reducing waiting time, reducing cost of service, public harassment and travel time. Bangladesh achieved 94.6% immunization, and no wonder Prime Minister Sheikh Hasina received Vaccine Award, Ambassador Award in 2019. Bangladesh stepped up to international solidarity by sending emergency medicines, PPEs and medical personnel to our friendly countries, including a few in the WHO Southeast Asia region. Our government facilitates safe passage for many students from our region pursuing higher medical degrees in public and private institutions here in Bangladesh. We work with UN agencies and their partners to make sure that the persecuted people from the neighboring Myanmar temporarily sheltered here in Bangladesh also had access to relevant health protocols and treatment free of cost. While we purchased significant amount of vaccines, we are also grateful to our friends around the world, including USA, for sharing their stock of vaccines with us. The newly coined term, vaccine diplomacy, attests to the need to have a fair, inclusive, and equitable international pandemic treaty under the aegis of WHO. Our Honorable Prime Minister has already allocated land and resources for setting up our own vaccine research and production institute that we believe will be able to cater to the needs of other countries with limited capabilities. Bangladesh stands out among LDCs for having made the best use of the TRIPS agreement waivers for pharmaceutical patents. Our local pharmaceutical industry remains on a growth pathway with some of the entrepreneurs now investing in other countries like Saudi Arabia, Rwanda, and Kenya. We reaffirm Bangladesh's interest in working together with CRO member states on overall medical research, an issue our Honorable Prime Minister has been advocating at both national and international levels. She also virtually joined the Honorable Prime Minister of India at the inauguration of WHO Global Center for Traditional Medicine to extend support for the initiative particularly relevant for our region. In the last 2 years, our Prime Minister co-led the WHO Global Leaders Group on antimicrobial assistance to raise awareness about this intensifying threat in our midst. We hope that the discussions on AMR at this conference will also contribute to the UN high-level meeting scheduled for next year. Sheikh Hasina's commitment to promote World Diabetes Day, set up specialized hospitals on non-communicable diseases, and made insulin free of cost through community clinics has earned her the recognition as the first global ambassador on diabetes last year. She has readily joined the 10-member Global Leaders Network for protecting and promoting women's, children's, and adolescents' well-being. The WHO CRO champion on autism, Ms. Saima Wajed, is also serving as the Climate Vulnerable Forum Ambassador on Vulnerabilities and a member of the Chatham House Commission on Universal Health. She spearheaded a UN resolution on autism and other disabilities and currently promoting mental health care initiatives. Excellencies, ladies and gentlemen, Bangladesh is mostly known for its frontline diplomacy on climate change, migration and development, women empowerment, maritime governance, and a culture of peace. With our Honorable Prime Minister in the lead, we have also made some visible imprints in the arena of global health and diplomacy in the last few years. This international conference opens up a new frontier in our steadfast commitment to regional cooperation through exchange of ideas among experts on critical public health issues. On behalf of WHO CRO, we reaffirm our pledge to work together with our international partners to uphold the right to health and well-being for all our peoples. We sincerely thank the Honorable Health Ministers and senior officials from the region for making time to join us to reinforce our message. I thank you all for your kind participation. Joy Bangla, Joy Bangabandhu.
Thank you, Your Excellency.
Excellencies, ladies and gentlemen, now it is with distinct honor and pleasure I request Her Excellency Sheikh Hasina, the Honorable Prime Minister of the Government of the People's Republic of Bangladesh, to deliver her kind statement.
বিসমিল্লাহির রহমানির রহিম। আজকের অনুষ্ঠানের সভাপতি, সহকর্মীবৃন্দ, সম্মানিত অতিথিবৃন্দ, উপস্থিত সুধীমণ্ডলী, আসসালামু আলাইকুম, শুভ সকাল। জনস্বাস্থ্য ও কূটনীতি বিষয়ক এই আন্তর্জাতিক সম্মেলনে উপস্থিত সকলকে আমার আন্তরিক শুভেচ্ছা জানাচ্ছি। কোভিড পরবর্তী বিশ্ব বাস্তবতায় আপনাদের এই উদ্যোগ অত্যন্ত সময়োপযোগী হয়েছে বলে আমি মনে করি। কাকতালীয়ভাবে আজ বিশ্ব জনসংখ্যা দিবস। বলা হচ্ছে বিশ্বের জনসংখ্যা বর্তমানে 800 কোটি অতিক্রম করেছে, আর এর অন্যতম কারণ চিকিৎসা বিজ্ঞান ও প্রযুক্তি অভূতপূর্ব বিকাশ এবং মানুষের গড়ায়ু অনেক গুণ বেড়ে যাওয়া। গত 75 বছর ধরে বিশ্ব স্বাস্থ্য সংস্থা মানবতার কল্যাণে চিকিৎসার সুবিধা সকলের কাছে পৌঁছে দিতে নিরলসভাবে কাজ করে যাচ্ছে। আমি উপলক্ষে চিকিৎসা সেবায় নিবেদিত দেশে ও বিদেশের সকলকে আমার প্রাণঢালা অভিনন্দন জানাচ্ছি। আমি পরম শ্রদ্ধাভরে স্মরণ করি সর্বকালের সর্বশ্রেষ্ঠ বাঙালি জাতির পিতা বঙ্গবন্ধু শেখ মুজিবুর রহমানকে। আরও স্মরণ করছি 1975 সালে 15ই আগস্ট ঘাতকের নির্মম বুলেটে নিহত আমার মা বেগম ফজিলাতুন্নেসা মুজিব সহ সেই রাতে আমার 3 ভাই সহ যারা শাহাদাত বরণ করেছেন তাদেরকে। স্মরণ করছি মুক্তিযুদ্ধের 30 লাখ শহীদ ও 2 লাখ নির্যাতিত মা বোনকে। অনেক রক্তের বিনিময়ে আমরা আমাদের স্বাধীনতা অর্জন করেছি। শুধুবৃন্দ, স্বাধীনতার অব্যবহিত পরেই 1972 সালে বঙ্গবন্ধু শেখ মুজিব চিকিৎসা সেবা এবং জনগণের পুষ্টি স্তর উন্নয়ন ও জনস্বাস্থ্যের উন্নতি সাধনকে রাষ্ট্রের অন্যতম মৌলিক দায়িত্ব হিসেবে আমাদের সংবিধানে সংযোজন করেছিলেন। চিকিৎসা সেবাকে জনগণের দুর্গায় পৌঁছে দিতে তিনি ইউনিয়ন পর্যায় পর্যন্ত স্বাস্থ্য সেবা সম্প্রসারণের যুগান্তকারী উদ্যোগ নেন। প্রতিকারের থেকে প্রতিরোধ শ্রেয় এই মূলনীতিকে সামনে রেখে তিনি 1974 সালে ন্যাশনাল ইনস্টিটিউট অব প্রিভেন্টিভ অ্যান্ড সোশ্যাল মেডিসিন নিপসম এবং চিকিৎসা ও স্বাস্থ্য সংক্রান্ত গবেষণার প্রচলন, মান নিয়ন্ত্রণ ও পর্যবেক্ষণের লক্ষ্যে বাংলাদেশ মেডিকেল রিসার্চ কাউন্সিল BMRC প্রতিষ্ঠা করেন। মানসম্মত চিকিৎসা শিক্ষা ও গবেষণা নিশ্চিত করার লক্ষ্যে তিনি 1972 সালে স্থাপন করেছিলেন ইনস্টিটিউট অফ পোস্ট গ্রাজুয়েট মেডিসিন অ্যান্ড রিসার্চ, যা এখন বাংলাদেশের প্রথম মেডিকেল বিশ্ববিদ্যালয় হিসেবে প্রতিষ্ঠা লাভ করেছে। 1996 সালে আওয়ামী লীগ যখন সরকারে আসে তখন বাংলাদেশে প্রথম মেডিকেল বিশ্ববিদ্যালয় প্রতিষ্ঠা করি। এছাড়াও দেশের প্রথম পঞ্চবার্ষিকী পরিকল্পনায় দেশের স্বাস্থ্য খাতকে সর্বাধিক গুরুত্ব দিয়ে এ খাতে বিকাশের দীর্ঘমেয়াদী পরিকল্পনা গ্রহণ করা হয়। মোট কথা, একটি জনকল্যাণমুখী আধুনিক স্বাস্থ্য ব্যবস্থা গড়ে তোলার যে ভিত্তি জাতির পিতা বঙ্গবন্ধু শেখ মুজিব বাংলাদেশে করে গিয়েছিলেন, তারই পথ ধরে আওয়ামী লীগ সরকার ক্ষমতা আসার পর থেকে আমরা আমাদের দেশের মানুষের স্বাস্থ্যসেবা নিশ্চিত করার চেষ্টা করে যাচ্ছি। প্রিয় সুধী, 1975 সালে জাতির পিতাকে নির্মমভাবে হত্যা করার পর এই স্বাস্থ্য সেবা সহ সব খ্যাতি যত কাজগুলি তিনি করেছিলেন সেগুলি মিলিটারি ডিক্টেটরে একের পর এক ক্ষমতা আসে, যার ফলে সব সেবাগুলি আর মানুষ বঞ্চিত হতে থাকে, মানুষ আর তা পায়নি। কাজে সামরিক একনায়কদের শাসন আমলে জনস্বাস্থ্য কখনো একটি তাদের অগ্রাধিকার তালিকায় ছিল না। দীর্ঘ গণতান্ত্রিক সংগ্রামের মধ্য দিয়ে বাংলাদেশের জনগণের ভোট ও ভাতের অধিকার পুনঃপ্রতিষ্ঠা করে আমার দল বাংলাদেশ আওয়ামী লীগ 1996 সালে পুনরায় সরকার গঠন করার সুযোগ পায়। দায়িত্ব গ্রহণের পরপরই আমরা জনগণের দোরগোড়ায় মানসম্মত স্বাস্থ্যসেবা পৌঁছে দেওয়ার লক্ষ্যে বঙ্গবন্ধু শেখ মুজিবের অসমাপ্ত কাজ সমাপ্ত করার উদ্যোগ গ্রহণ করি। দেশের প্রতি কম বেশি 6,000 মানুষের জন্য একটি করে সারা দেশে মোট 18,000 কমিউনিটি ক্লিনিক স্থাপনের কার্যক্রম শুরু করি। 2001 সালে আমাদের সরকার মেয়াদ শেষ হওয়া পর্যন্ত সারা দেশে প্রায় 8,000 কমিউনিটি ক্লিনিক আমরা চালু করেছিলাম। আরও 2,500 কমিউনিটি ক্লিনিকের অবকাঠামো নির্মাণের কাজ চলমান ছিল। তো 2001 সালে নির্বাচনে আওয়ামী লীগ সরকারে আসতে পারেনি। 2001 সালে খালেদা জিয়ার নেতৃত্বে বিএনপি জামাত জোট সরকার গঠন করে এবং সরকার গঠন করেই কমিউনিটি ক্লিনিকগুলি বন্ধ করে দেয়। গ্রামের মানুষ স্বাস্থ্য সেবা থেকে বঞ্চিত হয়। 2009 সালে আমরা পুনরায় সরকার গঠন করি দ্বিতীয়বার, এবং এই সরকার গঠনের পর থেকে আমরা কমিউনিটি ক্লিনিকগুলি আবার চালু করি এবং বর্তমানে প্রান্তিক জনগোষ্ঠীর স্বাস্থ্য সেবায় সারা দেশে প্রায় 14,500 কমিউনিটি ক্লিনিক এবং এর সঙ্গে আমাদের ইউনিয়ন স্বাস্থ্য কেন্দ্র জনগণের সেবা দিয়ে যাচ্ছে। এগুলোর মাধ্যমে মাতৃ ও শিশু স্বাস্থ্য সেবা সহ 30টি অতি প্রয়োজনীয় ঔষধ বিনামূল্যে জনগণকে প্রদান করা হচ্ছে। এছাড়াও ডায়াবেটিক রোগীদের জন্য বিনামূল্যে ইনসুলিন প্রদানের বিষয়টিও প্রক্রিয়াধীন রয়েছে। এই মুহূর্তে এক একটি ক্লিনিকে প্রতিদিন গড়ে কম বেশি 40 জন সেবা প্রার্থী সেবা গ্রহণ করছেন, যার মধ্যে 80% নারী ও শিশু। সারা দেশে প্রায় 4,000 কমিউনিটি ক্লিনিকে স্বাভাবিক প্রসবকালীন সেবাও প্রদান করা হচ্ছে। এটি আমার ও দেশের জন্য অত্যন্ত গৌরবের ও আনন্দের যে সম্প্রতি জাতিসংঘ সাধারণ পরিষদের সর্বসম্মতিক্রমে গৃহীত একটি প্রস্তাবে বাংলাদেশের কমিউনিটি ক্লিনিক ভিত্তিক স্বাস্থ্য সেবা মডেলকে স্বীকৃতি দেওয়া হয়েছে, যা এটা অবশ্য দা শেখ হাসিনা ইনিশিয়েটিভ হিসেবে অভিহিত করা হয়েছে। এর মাধ্যমে যদি বিশ্বের বিভিন্ন অঞ্চলের মানুষও সেবা পায়, সত্যি আমরা আনন্দিত হব এবং আমাদের অভিজ্ঞতা বা আমরা কীভাবে এটা করেছি সেটা সকলকে জানাতে আমরা আগ্রহী। সম্মানিত উপস্থিতি, জনগণের কাছে আমাদের দেওয়া প্রতিশ্রুতি বাস্তবায়নে বিগত 14.5 বছরে সারা দেশে হাসপাতালগুলোর শয্যা সংখ্যা বৃদ্ধি সহ চিকিৎসক, নার্স, প্রশিক্ষিত স্বাস্থ্যকর্মী সংখ্যাও বৃদ্ধি করা হয়েছে। মেডিকেল শিক্ষার প্রসারে নতুন নতুন মেডিকেল কলেজ, ডেন্টাল কলেজ, নার্সিং ইনস্টিটিউট, মেডিকেল অ্যাসিস্ট্যান্ট ট্রেনিং স্কুল ও হেলথ টেকনোলজি ইনস্টিটিউট প্রতিষ্ঠা করা হয়েছে। আমরা প্রায় 40,000 মতো, এখন 45,000 নার্স এখন আমাদের, আর প্রায় 22,000 মতো ডাক্তার রয়েছে। সেই সাথে সাথে আমাদের যে মেডিকেল টেকনোলজিস্ট বা অ্যাসিস্ট্যান্ট তাদের সংখ্যা আমরা বৃদ্ধি করে সেবাটা জনগণের দোরগোড়ায় পৌঁছে দেওয়ার পদক্ষেপ নিয়েছি। চিকিৎসা বিষয়ে বিশ্বমানের স্বাস্থ্যসেবা প্রয়োজনীয় গবেষণা কর্মকাণ্ড পরিচালনার সুযোগ সৃষ্টির লক্ষ্যে আমরা বঙ্গবন্ধু শেখ মুজিব মেডিকেল বিশ্ববিদ্যালয় সহ মোট 4টি মেডিকেল বিশ্ববিদ্যালয় প্রতিষ্ঠা করা হয়েছে। পর্যায়ক্রমিকভাবে আরও 4টি মেডিকেল বিশ্ববিদ্যালয় আমরা প্রতিষ্ঠা করব ইনশাল্লাহ। স্থাপন করা হয়েছে হৃদরোগ ইনস্টিটিউট, কিডনি ইনস্টিটিউট, গ্যাস্ট্রো লিভার ইনস্টিটিউট, ক্যান্সার ইনস্টিটিউট, নিউরো ইনস্টিটিউট, চক্ষু ইনস্টিটিউট, বার্ন ইনস্টিটিউট, ইএনটি অর্থাৎ নাক, কান, গলা সহ বিভিন্ন বিশেষায়িত ইনস্টিটিউট ও হাসপাতাল। প্রতি জেলায় কমপক্ষে একটি করে মেডিকেল কলেজ ও হাসপাতাল স্থাপন করার কাজ এগিয়ে চলছে। শিশু ও মাতৃমৃত্যু হ্রাসে বাংলাদেশ উল্লেখযোগ্য অগ্রগতি সাধন করেছে। এমডিজি পুরস্কার 2010 অর্জন ছিল শিশু মৃত্যু হারে হ্রাসে বাংলাদেশের সাফল্যেরই আন্তর্জাতিক স্বীকৃতি। প্রতিরোধযোগ্য রোগ থেকে শিশুদের সুরক্ষার জন্য চলমান রাখা হয়েছে সম্প্রসারিত টিকাদান কর্মসূচি ইপিআই। ইউনিসেফের হিসেব অনুযায়ী কোভিডকালীন সময়ে শিশুদের টিকা প্রদানের ক্ষেত্রে বিশ্বের অন্যতম শীর্ষ দেশ ছিল বাংলাদেশ। একই সঙ্গে নিয়মিত শিশুদের ভিটামিন এ ক্যাপসুল ও কৃমিনাশক ট্যাবলেট খাওয়ানো হচ্ছে। বিশ্ব স্বাস্থ্য সংস্থা বাংলাদেশকে পোলিও ও ধনুষ্টঙ্কার মুক্ত ঘোষণা করেছে। কুষ্ঠরোগী পুরোপুরি নির্মূল হয়েছে। কালাজ্বর এখন প্রায় বিলুপ্ত। যক্ষ্মা ও ম্যালেরিয়া নির্মূলের দিকে আমরা অগ্রসর হচ্ছি। দেশের 97% মানুষের কাছে সুপেয় পানি ও স্যানিটেশন সুবিধা পৌঁছে দেওয়া হয়েছে। মা ও শিশু পুষ্টি চাহিদা পূরণ ও শিশু শারীরিক বৃদ্ধি ও মানসিক বিকাশের জন্য মা ও শিশু সহায়তা কর্মসূচি আমরা গ্রহণ করেছি। কর্মজীবী মাদেরকে আমরা বিশেষ ভাতা দিচ্ছি। ল্যাকটেটিং মাদার, যারা মা বুকের দুধ খাওয়ায়, তাদেরকে আমরা বিশেষ ভাতা দিচ্ছি। স্কুলগামী শিক্ষার্থীদের পুষ্টি চাহিদা পূরণে এবছর আমরা দেশব্যাপী স্কুল মিল চালু করার উদ্যোগ নিয়েছি। সরকারি বেসরকারি অফিস আদালত, ব্যাংক, বিমা, রেল স্টেশন সব জায়গায় ব্রেস্ট ফিডিং কর্নার স্থাপন করবারও নির্দেশ আমরা দিয়েছি। পরিবার পরিকল্পনা সেবা সহজীকরণ সহ মা ও শিশু স্বাস্থ্যসেবা নিশ্চিত করার জন্য আমরা বিভিন্ন কার্যক্রম পরিচালনা করে যাচ্ছি। ইউনিয়ন পর্যায়ে দক্ষ ধাত্রী মিডওয়াইফের মাধ্যমে নিরাপদ প্রসব সেবা দেওয়া হচ্ছে। জেলা শহরে বিদ্যমান মা ও শিশু কল্যাণ কেন্দ্রগুলোকে মা ও শিশু হাসপাতালে রূপান্তর করা হয়েছে। কৈশোরকালীন যে জন্মহার সেটা কাঙ্ক্ষিত পর্যায়ে নামিয়ে আনতে আমরা বাল্যবিবাহ নিরোধ করার যথাযথ ব্যবস্থা নিয়েছি এবং 2017 থেকে 2030 মেয়াদে একটি জাতীয় কৈশোর স্বাস্থ্য কৌশলপত্র অনুমোদন করা হয়েছে। বাল্যবিবাহ যাতে কম হয় তার জন্য আমরা জনসচেতনতা সৃষ্টি করছি, মানুষের মাঝে সেই চেতনাটা ফিরিয়ে আনছি এবং মেয়েদের শিক্ষা ও কর্মসংস্থানের ব্যবস্থাও করে দিচ্ছি। চতুর্থ স্বাস্থ্য, জনসংখ্যা ও পুষ্টি খাত কর্মসূচির আওতায় 31টি অপারেশনাল প্ল্যানের মাধ্যমে আমরা সারা দেশে স্বাস্থ্য সেবা প্রদান করছি। স্বাস্থ্য খাতকে যুগোপযোগী করতে প্রণয়ন করা হয়েছে জাতীয় স্বাস্থ্যনীতি 2011। সেবা সহজ করার জন্য 106টি উপজেলায় প্রতিটি পরিবারের সদস্যদের ডিজিটালি হেলথ ডাটা সংগ্রহ করা হচ্ছে। এ পর্যন্ত 11 লাখ গ্রামীণ জনগণকে হেলথ আইডি কার্ডও দেওয়া হয়েছে। পর্যায়ক্রমে সারা দেশে হেলথ আইডি কার্ড প্রদান করা হবে। দেশের বিভিন্ন হাসপাতালে টেলিমেডিসিন সেবা চালু করা হয়েছে। সেই সঙ্গে চালু করা হয়েছে প্রাথমিক স্বাস্থ্য সেবা সম্পর্কিত তথ্য প্রদানের জন্য হটলাইন, মা টেলি হেলথ সার্ভিস। এই নামে প্রসূতি মায়ের গর্ভকালীন ও প্রসব পরবর্তী সেবা প্রদান করা হচ্ছে। ডিজিটাল প্ল্যাটফর্ম সুরক্ষার মাধ্যমে দেশব্যাপী কোভিড-19 টিকা ব্যবস্থাপনা করা হচ্ছে। দেশে প্রায় 350টি হেলথ টেক স্টার্ট আপ প্রতিষ্ঠিত হয়েছে। স্টার্ট আপ স্বাস্থ্য ব্যবস্থা গড়ে তোলার মাধ্যমে দেশের প্রত্যন্ত অঞ্চলে স্বাস্থ্য সেবা পৌঁছে দেওয়ার উদ্যোগ আমরা গ্রহণ করেছি। অটিজম ও নিউরো ডেভেলপমেন্টাল প্রতিবন্ধী ব্যক্তিদের স্বাস্থ্য ও জীবন ঝুঁকি হ্রাস কল্পে আমরা নিউরো ডেভেলপমেন্টাল প্রতিবন্ধী ট্রাস্ট গঠন করেছি। এই ট্রাস্টের আওতায় বঙ্গবন্ধু প্রতিবন্ধী সুরক্ষা বীমা চালু করা হয়েছে। প্রতিবন্ধী জনগোষ্ঠীকে সেবা প্রদানের জন্য দেশের 64টি জেলা ও 39টি উপজেলায় মোট 103টি প্রতিবন্ধী সেবা ও সাহায্য কেন্দ্র পরিচালনা করা হচ্ছে। আরও 211টি কেন্দ্র স্থাপনের কার্যক্রম চলমান রয়েছে। মানসিক স্বাস্থ্য সুরক্ষা সরকার মানসিক স্বাস্থ্য আইন 2018 প্রণয়ন করেছে। আমরা একটি জাতীয় পেশাগত স্বাস্থ্য ও নিরাপত্তা বিষয়ক গবেষণা ও প্রশিক্ষণ ইনস্টিটিউট স্থাপন করছি। 32টি শ্রম কল্যাণ কেন্দ্রের মাধ্যমে বিশেষজ্ঞ চিকিৎসকদের কাছ থেকে শ্রমজীবী মানুষের নিয়মিত চিকিৎসা সেবা প্রদান করা হচ্ছে। নারী শ্রমিকদের মাতৃত্ব সুরক্ষায় 122 দিন অর্থাৎ 4 মাসের মজুরি সহ ছুটি ও মাতৃত্বকালীন সুবিধা শ্রম আইনে অন্তর্ভুক্ত করা হয়েছে। বাংলাদেশে অবস্থিত বিশ্বের বৃহত্তম বার্ন প্লাস্টিক সার্জারি ইনস্টিটিউট স্কিন ব্যাংকের কার্যক্রমও শুরু করেছে ও একটি লিম্ব সেন্টার স্থাপনের কার্যক্রম এগিয়ে চলছে। এছাড়া বঙ্গবন্ধু শেখ মুজিব মেডিকেল বিশ্ববিদ্যালয়ের 750 শয্যার একটি সুপার স্পেশালাইজড হাসপাতালও উদ্বোধন করা হয়েছে। আমাদের স্বাস্থ্যসেবা সম্প্রসারণ ও গুণগত মানোন্নয়নের ফলে বাংলাদেশের জনগণের গড় আয়ু, যা 2006 সালে ছিল 59 বছর, বর্তমানে তা 73 বছরে উন্নীত হয়েছে। অপেক্ষাকৃত কম খরচে চিকিৎসার মৌলিক চাহিদা পূরণের ধারাবাহিকতায় আমাদের সরকার ইউনিভার্সাল হেলথ কভারেজ নিশ্চিত করতে বদ্ধপরিকর। সুধীমণ্ডলী, 2020 সালের শুরুতে বিশ্বব্যাপী করোনা ভাইরাস অতিমারি ছড়িয়ে পড়ার পর অন্যান্য দেশের মতো বাংলাদেশেও এর অভিঘাত এসে পড়ে। কিন্তু স্বাস্থ্য খাতে আমাদের দীর্ঘদিনের চলমান কার্যক্রমের ধারাবাহিকতায় এবং সরকারের সময়োচিত পদক্ষেপের কারণে আমরা মানুষের প্রাণহানি যেমন কমাতে পেরেছি, তেমনি অর্থনীতিকে সচল রাখতে সক্ষম হয়েছি এবং তার জন্য বিশেষ প্রণোদনা আমরা দিয়েছি। বিশেষত কোভিডকালীন স্বাস্থ্য সংকট মোকাবেলায় উন্নয়ন সহযোগীদের সহায়তায় দ্রুততম সময়ে টিকা ক্রয় ও প্রয়োগের ব্যবস্থা করতে পেরেছি। দেশে টিকা পাওয়ার উপযোগী শতভাগ মানুষকে বিনামূল্যে কোভিড-19 টিকা প্রদান করা হয়েছে। সামগ্রিক কোভিড ব্যবস্থাপনা উত্তরণে বাংলাদেশ বিশ্বের প্রথম 5টি দেশের মধ্যে অন্যতম। এখানে আমি আরেকটি বিষয় উল্লেখ করতে চাই, আর তা হলো কোভিড মহামারীর এই সময়েও কিন্তু বাংলাদেশ প্রতিবেশী মিয়ানমার থেকে আশ্রয় নেওয়া প্রায় 12 লাখ রোহিঙ্গাকে ভুলে যায়নি। তাদের নিয়মিত পরীক্ষা, টিকা ও স্বাস্থ্য সেবা প্রদানের সার্বিক ব্যবস্থা গ্রহণ করা হয়েছে। একথা ভুলে গেলে চলবে না যে এদেশে আশ্রিত বিশাল জনগোষ্ঠীটি সবসময় আমাদের অঞ্চলের জন্য একটি মানবিক সংকট ও নিরাপত্তার হুমকি। তাদের নিরাপদে ও সসম্মানে মিয়ানমারে প্রত্যাবর্তনের মধ্য দিয়েই কেবল এই সংকটের টেকসই সমাধান নিশ্চিত করা সম্ভব। আমি আশা করি মিয়ানমার তাদের এই নাগরিকদের খুব দ্রুত তাদের দেশে ফিরিয়ে নিয়ে যাবেন। সম্মানিত উপস্থিতি, কোভিড মহামারী প্রমাণ করেছে আমরা যতই নিজেদের পরস্পর বিচ্ছিন্ন ভাবি না কেন, আমাদের সকলের ভাগ্য আসলে এক সূত্রেই গাঁথা। আমরা কেউই সুরক্ষিত নই যতক্ষণ পর্যন্ত না আমরা সকলের সুরক্ষা নিশ্চিত করতে পারছি। আজ সময় এসেছে টেকসই উন্নয়ন অভিষ্ট 3 ও অভিষ্ট 17 আলোকে জনস্বাস্থ্য সম্পর্কিত স্মৃত লক্ষ্য অর্জনে কার্যকর বৈশ্বিক অংশীদারিত্ব প্রতিষ্ঠা করার। এ প্রক্রিয়ার উদ্দেশ্য হবে জনগণের স্বাস্থ্য ঝুঁকি মোকাবেলায় পিছিয়ে থাকা দেশগুলোর নিজস্ব সক্ষমতা বৃদ্ধির মাধ্যমে আন্তর্জাতিক পর্যায়ে তাদের কার্যকর অংশগ্রহণের সুযোগ নিশ্চিত করা। এই উদ্দেশ্য পূরণে সুস্পষ্ট বৈশ্বিক অঙ্গীকারের পাশাপাশি লক্ষ্য অভিমুখী নিবেদিত কূটনৈতিক তৎপরতার কোনো বিকল্প নেই। আর জনস্বাস্থ্য সুরক্ষার অতীত রেকর্ড এবং কোভিড মহামারীর অভিঘাত মোকাবেলায় সাম্প্রতিক সাফল্য বিবেচনায় বাংলাদেশ এই প্রচেষ্টার পুরোভাগে থাকবে বলে আমি বিশ্বাস করি। বিশ্ব স্বাস্থ্য সংস্থার দক্ষিণ পূর্ব এশীয় দেশগুলোর মাননীয় মন্ত্রীবর্গ এবং ঊর্ধ্বতন কর্মকর্তাদের উপস্থিতিতে আমি আঞ্চলিক সহযোগিতা সংক্রান্ত 5 দফা সুনির্দিষ্ট প্রস্তাবনা উত্থাপন করছি। প্রথমত, ভবিষ্যৎ জরুরি স্বাস্থ্য পরিস্থিতি মোকাবেলায় পর্যাপ্ত প্রস্তুতি ও সামঞ্জস্যপূর্ণ প্রতিক্রিয়া নিশ্চিত করতে আমাদের সমন্বিত পদক্ষেপ নিতে হবে। দ্বিতীয়ত, নিরাময়যোগ্য সংক্রামক রোগ নির্মূল করতে ক্রমবর্ধমান অসংক্রামক রোগের বিস্তার রোধে বিদ্যমান উত্তম চর্চা বিনিময়ে আমাদের একত্রে কাজ করতে হবে। তৃতীয়ত, মানসিক স্বাস্থ্যকে জাতীয় স্বাস্থ্য ব্যবস্থার মূল ধারায় যুক্ত করতে এবং পানিতে ডুবে যাওয়া বা দুর্ঘটনার মতো প্রাণঘাতী জনস্বাস্থ্য বিপর্যয় রোধে আমাদের আরও মনোযোগী হতে হবে। চতুর্থত, আমাদের নিজ নিজ স্বাস্থ্য শিক্ষা ও গবেষণা অবকাঠামোর মধ্যে সমন্বয় জোরদার করতে হবে। বিশেষ করে জলবায়ু পরিবর্তনের ফলে বেড়ে যাওয়া বিভিন্ন গ্রীষ্মমণ্ডলীয় রোগের প্রাদুর্ভাব কমাতে সম্মিলিতভাবে কাজ করতে হবে। এবং পঞ্চমত, মা ও শিশু এবং কিশোর কিশোরীদের স্বাস্থ্যকে টেকসই উন্নয়ন অভিষ্ট 3 অর্জনের মাপকাঠি হিসেবে বিবেচনা করে এই অঞ্চলে সার্বজনীন স্বাস্থ্য সুরক্ষা নিশ্চিত করতে সকলকে ঐক্যবদ্ধ হতে হবে। বিশ্ব স্বাস্থ্য সংস্থাকে কেন্দ্র করে বৈশ্বিক স্বাস্থ্য ব্যবস্থাপনা আগামী 75 বছর এবং তারপরেও যেন অর্থপূর্ণভাবে সমগ্র মানবতার সেবা করে যেতে পারে, সেই লক্ষ্যে আসুন আমরা সকলে একযোগে কাজ করি, একে অপরের সহযোগিতা করি এবং আমাদের অভিজ্ঞতা বিনিময় করি। আপনাদের সকলকে আমার আন্তরিক শুভেচ্ছা জানাচ্ছি এবং এই সম্মেলন সফল হোক সে কামনা করে আমি আমার বক্তব্য শেষ করছি। ধৈর্য ধরে বক্তব্য শোনার জন্য আন্তরিক ধন্যবাদ জানাচ্ছি। জয় বাংলা, জয় বঙ্গবন্ধু, বাংলাদেশ চিরজীবী হোক।